One of the greatest medical and public health breakthroughs of the 20th century was the development of antibiotics. Antibiotics allowed us to successfully treat myriads of infections that had previously killed or seriously injured millions of individuals. It led to expansion of the pharmaceutical industry, which developed newer and more potent antibiotics. And in countless ways, it changed the way we practice human and animal medicine. However, bacteria are quite hardy and adaptable. In the last 30 years, we have seen an increase in the number of bacteria that are immune or resistant to our antibiotics. We've also seen a decline in the number of new antibiotics being developed. This is literally a deadly combination. In fact, over 2 million infections and over 23,000 deaths occur on an annual basis in the United States due to antibiotic-resistant organisms. Antibiotic resistance has become a major public health problem, a problem few people know about. Because of that, we will talk about antibiotic resistance on today's episode of A Public Health Journal. Please stay tuned.
Welcome to A Public Health Journal, a program that explores public health issues facing our society today and tomorrow. The host of the show is Dr. Ed Ellinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health and the Hennepin County Human Services and Public Health Department, all working together towards the goal of healthy people living in healthy communities.
Welcome to A Public Health Journal. Today we're going to talk about antibiotic-resistant organisms. Our reliance on antibiotics to keep us safe makes this decline in their effectiveness of major concern. Antibiotic resistance has become a major public health problem. Because of that, I've invited Sara Tomczyk to join us to talk about this issue. Sara is a preventive medicine fellow at the Centers for Disease Control and Prevention, or CDC. She is currently working on a One Health antibiotic stewardship strategy at the Minnesota Department of Health. Sara is an infectious disease epidemiologist who has worked on outbreak investigations in more than 10 countries across Africa, Southeast Asia, and the Americas. Sara, welcome to our program.
Thank you for having me.
And thank you for being here in Minnesota to help us on this issue of antibiotic resistance. So let's start with some really basic things. First of all, what are antibiotics?
Antibiotics are an important public health tool. They're an important treatment. Ever since the development of penicillin, it's essentially been a miracle drug. It's something that has allowed once killer infections to be treated. It's allowed us to prevent infections in surgery or in cancer treatment. And so it's an incredibly important piece of medicine. Although with any resource, it's also a precious resource.
All right, so it does, two things that I think most people don't realize. It treats diseases once you get them, but it also prevents things. How is it used to prevent disease?
Right, so in terms of prevention, I think two key examples of it, as I just mentioned, is in terms of surgery. So once we go into surgery, it's used as a prophylactic, in terms of infection prevention, and then also for other intensive care unit medicines or in cancer treatment, et cetera.
All right, so most people would assume that antibiotics are things that you take in pill form or get an injection of penicillin in the good old days, but antibiotics are more ubiquitous than that. Where else do we find antibiotics?
Right, yes, and they're also in our soaps, they're also in our sprays, so when we're washing our hands, you have antibiotics in the soap to prevent infections. So you're absolutely right, we see it in a lot of products.
And are those effective in preventing disease? Because I understand that sometimes just soap without antibiotics in them are just as effective as soaps with antibiotics.
Yes, absolutely. Yeah, so hand hygiene is critical, but soaps without antibiotics also does the trick in terms of infection prevention.
Right. And antibiotics are used not just for humans, they're also used for animals, right? How are antibiotics used in veterinary medicine and in agriculture?
Yes, so just like humans get sick, animals also get sick. And so antibiotics are an important treatment and an important public health tool in veterinary medicine or in agriculture on the farms. So this is another important use of antibiotics as well.
Okay, so do they, again, treat illnesses and prevent illnesses just like you used it for humans?
Right, so certainly on the treatment side, it's also used to prevent antibiotics. There is some new legislation in the works in the United States that will actually be providing new rules on how we use antibiotics for prevention of infections in animals, to be judicious as possible. But they are used in both ways, prevention and treatment.
And has the use of antibiotics increased since the 1940s when penicillin was created? Has there just been continued more and more use of antibiotics?
Yes, so we have seen increasing trends of both overuse and misuse of antibiotics.
Now, Grady, when you talk about overuse and misuse, what are you talking about?
Right, and so actually, just to lay a foundation, any type of antibiotic use can lead to resistance. But in particular, what we're concerned about is when we use antibiotics, when we're talking about misuse, when we use antibiotics for something that's not bacteria, so something that it can't actually treat. And a good example of that is your common cold or your cough. That is most likely always caused by a virus. And so when we take antibiotics for our common cold, that's not something that is appropriate. It's not something that will treat a virus, antibiotics. And so that would be a prime example of misuse. Now, overuse is also similar in the sense of we're using too many antibiotics to treat one infection. So it might be a bacterial infection, but we're using too many antibiotics to treat that same infection.
Right. Now, I've got a little map here that shows antibiotic prescriptions per 1,000 persons in the United States, according to states. It looks like antibiotics are used differently throughout the country. Tell us a little bit about what you see on this map.
Yeah, so if you see in terms of the darker colors on this map, that's where we see more antibiotic prescriptions per 1,000 persons. And so certainly you see in the southeast, it's a little bit larger of a problem. But I think the bottom line is that antibiotic use and misuse and overuse is a problem in all states. I mean, we can improve everywhere. You can see that Minnesota in particular is sort of in the middle. There are certainly states that, they're better than some states, but again, the bottom line is that we can improve everywhere across the U.S.
Yeah. So does this mean that people practice medicine differently, or does this mean that there are more infections in some parts of the country than in other parts of the country? Sort of the culture different in different places?
I think it's multifactorial, so it's a combination. So we might see different patterns of infections in different areas because we also have different climates, we have different interactions between people, and then there's a cultural aspect too. So the public might seek antibiotics in a different way, or clinicians might prescribe in a different way, and that would be sort of the cultural piece as well. Another thing to remember if we're looking at patterns of antibiotic-resistant infections or antibiotic prescriptions is that we can also measure that in different ways across the state. And so it's important just to remember back to the bottom line is that we can probably improve in all areas on certain common goals, like I mentioned in terms of trying to avoid antibiotics for something like your common cold or your virus.
So, I mean, the pharmaceutical industry is a huge industry, and I think a lot of it has been built up around antibiotics. Are there more and more antibiotics available and more powerful antibiotics?
So, I think that it depends. I mean, I think their antibiotics are still readily available at our primary clinic, for example, for something like the common cold. But in terms of the development of antibiotics, I think we've actually seen not as many antibiotics being developed like penicillin once was as a miracle drug. And so it's a combination in terms of goal setting on the national level, for example, is that we want to get better at antibiotic prescribing, but we also want to encourage innovation and development of new antibiotics.
Okay. Well, we've talked a bunch about antibiotics. Now I want to talk about antibiotic resistance, but we'll have to do that in the next segment because we're going to take a little break. We'll be back right after this message. Welcome back. We're talking about antibiotic resistance with Sara Tomczyk, a preventive medicine fellow from CDC working at the Minnesota Department of Health. Sara, in the first part we talked about antibiotics, what they are and how they're used, and a little bit about some of their inappropriate use. But let's talk about antibiotic resistance. What do we mean when we're talking about antibiotic resistance?
Right. And so, like we said earlier, antibiotics have been an incredibly important public health tool and treatment. But like any resource, we need to use them judiciously. And what we found is with antibiotic use, and in particular antibiotic misuse and antibiotic overuse, is that bacteria have changed. They've changed in a way that has either reduced the effectiveness of antibiotic drugs, or they've reduced or eliminated the effectiveness of drugs. And so that's what we mean when we say resistant resistant bacteria.
Mm-hmm. So what kind of organisms have been immune or resistant to antibiotics? Things that we thought, well, we had under good control, and now all of a sudden we don't have the tools to treat them.
So we've seen a range of bacteria, unfortunately, that have become resistant to drugs. We have things like our respiratory pathogens, so bugs called Streptococcus pneumoniae or tuberculosis. We have sexually transmitted diseases like gonorrhea. We also have our GI bugs, so this could be Campylobacter or Salmonella. So unfortunately, we've seen quite a range of bacteria that has become resistant to antibiotics.
In fact, I'm wearing a TB tie that says it's antibiotic resistant. So, so how does antibiotic resistance develop? Is it just natural kind of occurring, or is it because of the misuse, or is it both?
It's both. So with every use of antibiotics, we have seen resistance. Well, what I should say is all antibiotic use can lead to antibiotic resistance. But in particular, what we want to try to address and what we want to try to improve is the misuse and the overuse piece, because antibiotics are still an important treatment and still an important public health tool to use. We just want to use them more appropriately and more judiciously.
So let's take an example. So somebody's got a cold, and you said we shouldn't be using antibiotics for a virus infection because they're not effective. But a lot of people do. Say, I get a cold, I'm going to go to the doctor and get an antibiotic. So they get an antibiotic. How does that lead to resistance? Because they're not effective on the virus in the first place. How does that lead to antibiotic resistance?
So when we take an antibiotic that is not going to treat something like a virus, we essentially give time for the bacteria to change. So to reduce its effectiveness or to reduce the effectiveness of the drug or eliminate the effectiveness. The same goes with maybe not taking the full antibiotic course. So maybe we do have a bacterial infection and the doctor has prescribed 7 days of antibiotics. We start to feel better in the middle and we stop. That's another way that we have given the time for the bacteria to potentially change and become resistant. Mm-hmm.
So when you say the overuse, I mean treating for things that are not appropriate, can you treat too long or too many? I know some organisms use multiple drugs to treat it.
Yeah, it's so, the other half to remember, so on one hand we have something like your common cold at the clinic, but then you also are obviously treating infections at the hospital setting. And so a lot of that depends on your diagnostic tools and identifying the right bug. And that sometimes takes a little time. And so clinicians may provide different antibiotics to try to cover that particular pathogen. And so sometimes they probably provide too many antibiotics in an effort to be cautious, but one way that we can work on improving antibiotic use is also to improve diagnostics. So we give clinicians the tools to make better decisions about antibiotic use.
Mm-hmm. Are the antibiotics used in animals the same as the antibiotics used in humans?
Yes, so there is some overlap. So there is some use of antibiotics that are of human healthcare importance in animals.
All right, so does the same thing hold with animal use? Overuse, used inappropriately, does that then also not just affect the animals but also affect humans?
Yes. And so we kind of have to see the big picture. So absolutely, in terms of animal antibiotic use, we see inappropriate use and overuse, and that's going to lead to resistant infections within our animals itself. So that could be our pets or on the farm in agriculture. And then maybe that resistant infection is released through the waste of the animals. Maybe that gets into our wastewater, and maybe that's also affecting our human healthcare, or it could be through food animals, so what we're eating as well. And so again, it's this big picture, kind of the circle of life in terms of the interconnectedness between antibiotic use in both human healthcare and animal healthcare.
So is antibiotic resistance a problem just in the United States, or is it a worldwide phenomenon?
It's definitely a global, it needs to be a global effort because it is a global issue. This is reflected in a lot of initiatives that are worldwide to address antibiotic resistance, so promoting a collaboration between countries, so not only nationally in different states, but also within different countries, and this is exemplified by the World Health Organization, so WHO, and efforts that they've had to address antibiotic use and antibiotic resistance. It's also been in the agriculture, in the food animal world as well globally. And so there's a lot of groups trying to bring people together to address this issue globally as well.
So, because I understand in some countries you can get antibiotics without a prescription, just go to a pharmacy and get them. That must lead to huge problems with antibiotic resistance.
Yeah, so of course there's a range of different challenges in different countries. And so if you have a system that perhaps doesn't have as much regulation on how you get an antibiotic or an antibiotic prescription, then that can lead to different challenges in terms of antibiotic resistance. So yes, we see it in different countries in different ways. Another challenging piece is how we measure it in different countries, because we don't have the same type of surveillance system in every state or every country. And so can sometimes also be hard to just compare what is the problem in different settings as well.
And I know you're doing something called antibiotic stewardship, and I want to talk about that, and also this whole concept of One Health, which we'll get into. But first, we need to take another little break. We'll be back right after this message.
Hart, what's going on?
I'm leaving.
Why? What did I do?
Not enough. You constantly ignore me. You barely eat anything healthy. You're half as active as you used to be. The pressure is just too much. I quit.
Okay, I get it. I'll do better. Just please, don't leave.
Okay. But remember, if I go, you go.
Listen to your heart. Don't let it quit on you. Uncontrolled high blood pressure could lead to stroke, heart attack, or death. Get yours to a healthy range before it's too late.
Welcome back. We're talking about antibiotic resistance, and we'll be talking about antibiotic stewardship and the concept of One Health with Sara Tomczyk from the Minnesota Department of Health. So we've talked about antibiotics, the problems we have with antibiotics. You're working on something called antibiotic stewardship. What does that mean?
So antibiotic stewardship is a term we use often in human healthcare. And so this is essentially, it can be a coordinated set of interventions that are meant to improve antibiotic prescribing or antibiotic use. So it's not that complicated of a definition. In fact, if you just think about the word, we all want to be good stewards of antibiotic use. But when we say an antibiotic stewardship program, for example, this might be a hospital or a healthcare facility program that is intended to improve antibiotic prescribing and prevent resistant infections.
So what kind of things would they do to do that?
So it could be something as simple as different staff trainings or training for healthcare professionals. Or it could be something that we've seen actually a lot of success with, something called electronic decision support. So this might be something that's worked into electronic medical records that could be prompts to remind the clinician of what might be the appropriate drug, dose, duration, time period. And things like that. But there's actually a range of different interventions. They've also looked at things like posters in the clinic for the public to see and the professionals to be reminded of, and so it's been quite a range of different things.
So are the pharmacists engaged in this in addition to the physicians and nurses who are prescribing?
So it's absolutely, and it needs to be multidisciplinary. So part of these antibiotic stewardship programs include both your physicians, your nurses, your nurse practitioners, your physician assistants, but essentially your pharmacists as well. And so the pharmacist can be an incredibly important support for all clinicians in terms of providing recommendations on the right drug, the right dose, the right duration, or providing a review of the antibiotics prescribed maybe in the last month at a particular facility.
Do clinicians really realize how big of a problem this is?
You know, there's a lot going on, for example, in Minnesota. There's a lot of facilities and a lot of clinicians acknowledging the problem of antibiotic resistance and acknowledging the need to improve antibiotic prescribing. But I also think we certainly have room to improve as well and continue to promote awareness on the issue.
Yeah, because aren't we sort of running out of antibiotics, and the bugs are continuously changing? Right. This could be a huge problem for us down the road.
So I think it's also appropriate to label it as an urgent public health threat. So it's absolutely something that we need attention on. You know, it's not, it's funny, it's called an emerging public health threat, but antibiotic resistance is not something that's new, because we've seen it since the development of penicillin, for example. But what's exciting is that we've just started to see more impetus and people coming together and trying to push for this important issue, because, yeah, again, it's an urgent public health threat. It's something that we need to address now so that years down the road we're not in a situation where we don't have anything to treat infections.
Right. But this is really a problem for all of us, and that's what gets into this whole idea of One Health. And I've got a little slide here, a little graphic that I'd like to have you talk about. What is One Health, and how does this bring all of us into better use of antibiotics, antibiotic stewardship across the board?
Right, so One Health is a concept that essentially acknowledges that the human healthcare and that animal healthcare and the health of our environment are all interconnected. Because like we talked about earlier, antibiotic use can lead to antibiotic-resistant infections in humans and in animals. You know, resistant infections can be spread between animals and humans, and then the antibiotics can be disposed of into our environment, or we find antibiotic resistance in our environment that might also spread to humans and animals, for example. And so again, it's this big picture, and it's showing how each of these pieces are related.
So if we get antibiotic use in animals or humans, we flush it down the toilet, it gets into the water supply, you know, rivers and streams, can that actually lead to antibiotic resistance development?
Yes, and so that's the interesting part about looking at this in terms of a One Health lens, because that's also a very important part that sometimes gets neglected. So the disposal of our antibiotics, or the antibiotics that might come out in our fecal waste or when we go to the bathroom, that could get into our environment, into our wastewater, and that could potentially lead to other resistant infections in humans again.
All right, certainly, you know, the healthcare field is worried about antibiotic resistance. Are the environmental folks and agriculture also worried about environmental or resistance?
So here in Minnesota, we have some very prestigious environmental scientists that are looking at some of these questions in terms of sort of on the chemistry side, how do antibiotics degrade in the environment? Or on the wastewater management, how can we treat our water to prevent antibiotics, the presence of antibiotics or antibiotic resistance? And then also on what is the proper disposal. So this is the public awareness piece on how do we dispose of our antibiotics appropriately so that we're not flushing them down the toilet and we're taking them to the pharmacy and trying to promote better disposal. So on the environment side, absolutely. On the animal side, there's also a lot going on. They're very active in terms of groups in agriculture, for example, with quality assurance or certification programs to promote better stewardship as well within those settings. So there's a lot going on. We have a lot of room to improve, but there are existing activities.
Right. So I suspect that the Centers for Disease Control and Prevention, CDC, and FDA and USDA, all of these federal agencies, are they all engaged in antibiotic resistance?
Absolutely. So actually in 2015, the White House released a national action plan on antibiotic resistance, and groups like the CDC, FDA, USDA are all coming together and working closely with the government on this. And we've seen support from both sides of the political aisle, for example, as well in this important issue. And CDC, for example, is doing some great things in terms of promoting the goals of that national action plan, but also in terms of awareness. They have something called Get Smart About Antibiotics Week, and this is every year in November. Minnesota participated this year. There's a lot of exciting components. It's meant to raise the awareness of this urgent public health issue and how can we prevent it, how can we promote better antibiotic use through different healthcare professional trainings or through different public awareness campaigns, etc. So they have a lot going on. Same with FDA. They're working to improve how antibiotics are used in agriculture and veterinary medicine, and with USDA in terms of also thinking about data collection. How do we measure on the farm, for example, antibiotic use or antibiotic resistance?
Right. Well, Sarah, this has been fascinating. A huge public health issue, thing that I don't think most people worry about, but it's something we all have to worry about. So thanks for bringing that message here.
Thank you for having me.
Good. And I'll be back with a closing comment right after this message. One of the greatest public health achievements of the 20th century was the decline in deaths due to infectious diseases. As you can see from this graph, the rate has dropped from 800 deaths per thousand in the population in 1900 to under 50 in the year 2000. But what is also striking is that most of the drop occurred prior to the introduction of penicillin in the 1940s. That means that all of the other control measures, like improvements in the sanitation of drinking water and wastewater, along with improved hygiene, were incredibly powerful. Certainly the advent of antibiotics was a great addition to our armamentarium of infectious disease fighting tools. But as we see the decline in their effectiveness, we must redouble our efforts to implement and support the other public health sanitary practices that continue to be effective. We need to invest in basic public health in addition to research on the development of new antibiotics. What's also dramatic in this graph is the spike in deaths in 1918 due to the Spanish flu pandemic. The threat of pandemic flu is always present, and because flu cannot be treated by antibiotics, we must be sure to also maintain our preparedness for such an outbreak. The bugs of the world never rest, so we can't either. That's all for today. Thanks for watching. I hope you can join us again next time on A Public Health Journal.